AEDs, or automated external defibrillators, are now common in many public places, including schools. The people behind the Mental Health First Aid program say by training 1,500 educators to spot key mental health signals and behavioral changes in students can be as life-saving as those AEDs.
Because you got to that patient quickly. That was the first aid that patient got. We have a program that does the same thing with respect to mental health. And that gets us, again, ahead of the curve in getting support services for that student.
Like a CPR course, Mental Health First Aid is an 8-hour training session that would give educators the tools they need to identify trouble before it spirals down into depression, suicide, or something more sinister.
The teachers can spot it, but do they have the skills to talk with that child, to have a conversation with that child? Not every individual, not every teacher is very comfortable talking about mental health.
Lisa Harvey McPherson is with Acadia Hospital in Bangor. She says the Mental Health First Aid course makes sense, has a proven track record, and is cost-effective, giving educators the tools they need to intervene.
It may be that Tommy's just having a bad day. With the Mental Health First Aid course, they develop those skills to feel comfortable approaching Tommy about the behavioral health challenges that they're observing, discuss those, and then really be that first responder to identify this child's at risk, and we need to link them to resources.
No one spoke out against this bill during the public hearing today. The bill is sponsored by Representative Jim Handy of Lewiston, who is the spouse of a WMTW News employee. Live in the studio, Jim Keithley, WMTW News 8.